go ahead and share my screen so everybody can see. Awesome. All right, everybody can see we're good to go?
Yes, I think so, Shanae.
Okay, thank you. So welcome everyone to today's Behavioral Health Advisory Group monthly meeting. I am actually going to turn it over to Margaret to give our official welcome, but this is my first time at this meeting and seeing everyone. I am the new coalition manager. My name is Shanae Vicks, and I'll kind of go into introductions a little bit later, but I just wanted to give a warm hello before we got started. So it's good to see everyone. Margaret, would you like to give the official welcome?
Sure. Go to the next slide, please, Shanae. As always, I just want to say welcome to everyone and thank you for joining us this afternoon for our BHAG monthly meeting. And I would like you to just be able to, as we always do, introduce yourself. For those that may be new, you can introduce yourself or you can put your name and organization in the chat. And then just to be a mindful question is basically what has been your favorite summer activity, or I'm not going to let summer go that easy. We'll say, what is your favorite summer activity? And I just wanted to open the floor up right now if anybody wanted to, if it's their first time here, that they can introduce themselves. Or if you're shy, you could just put it in the chat. Okay,
I guess I'll go first.
Okay.
Yeah, I am new. My name's Philip Terrell. I'm with Interdynamics. I'm the clinical director here. And my favorite summer activity actually has been a couple, just going to jazz concerts over the summer.
Okay, thank you, Carlos, for putting that in. Your swimming is your summer activity. Okay, anybody else?
I'll jump in. My name is Jeff Gordon. I'm fairly new. I'm with the Perion Health Services. And so far, my favorite summertime activity has been traveling and playing the piano.
Okay. So we got a good piano player. We have a jazz person and a piano player. I see this coming together as I don't know, some music things going on here. Okay, anyone else?
Larry.
My name is Jennifer Nelson. I'm with Interdynamics. And I'm in the room with Mr. Terrell. My favorite summer activity this year was I went to Paris for the first time.
Oh, wow. How nice. Very nice.
Great.
Okay, and I will add mine. I just enjoy really eating outside and having barbecues, using the grill and not having dirtying up the kitchen. So that's my favorite summertime activity.
That's a good one.
Okay, do you want to go to the next slide?
Sure.
I have the privilege of welcoming our new coalition manager, Shanae Nix. And I'm going to briefly give an opening introduction. And Shanae, I think it would probably be appropriate for you to really tell us a little bit more about yourself. That's more than what you want to just say on here, because we can read this. But she comes to us with a passionate health educator in the public health profession dedicated to advancing health equity and health literacy. And she originally was from Southern Jersey. Is Jersey Shore or just Southern Jersey?
Atlantic City.
Okay, we got
the area, close enough.
And of course, you moved to beautiful Maryland, and you earned your degree in psychology from Morgan State University, and then you got your master's from Johns Hopkins, with a concentration on health education, communication, and certification in maternal child. Shanae, we want to welcome you today. We're so thankful you're here. And I want to just turn it over to you and allow you to tell a little bit more about yourself.
Sure. So thank you so much. It's definitely a privilege being here. I came to Maryland for college and I never left. There's been ample opportunities here for me. I've been able to network with amazing people. Friends have become family. I started my own family here. So Maryland is my new home. I have officially this year spent half of my life in Maryland. So we're going over the hump here. But yeah, I have always been passionate about health. I've always been passionate about people, particularly those who are underrepresented, underserved. I'm very passionate about, being a voice for the people, but not just being that voice, but hearing theirs too, and being able to advocate for people in any way possible. I know that we all don't have the same access to resources, the same access to education, but that doesn't mean that we all don't deserve to live the best life possible, the healthiest life possible. And so I really just try to dedicate my work and my time, my passion to making sure that I am helping people as best as I can, where I can. And if I don't have the answers, I will find somebody who does. But again, it's a privilege being here, coming from Howard County Health Department. So now I'm with you all, Prince George's County, and just really excited to learn, to meet new people, and to really embrace this new experience. So thank you so much for having me.
Well, you are absolutely welcome, and we enjoy that you're here. And if you want to go ahead and proceed with the rest of it, it'll be your official first meeting, and we can turn over the
Yes.
keys to you.
Okay, great. Thank you. So just a quick review of our agenda today. We already did our welcome and introductions. We're doing the agenda review now. So after that, after this moment, we will actually have our BHAG Partners in Focus presentation. So there was some talk about having at least 2 partners come to a meeting to kind of give very brief overviews, to focus and highlight about their organization, the work that they're doing, how we can best engage and support them. So we'll have that today. And then following that, we will have a presentation about the Prince George's County Extreme Risk Protective Order Program. So we'll have that, and then we will end today's meeting with quite a few community announcements before adjourning. So let's go ahead and transition to our partners in focus. And I think at this time, Carlos, would you mind introducing our partner for today?
Absolutely, absolutely, and welcome to the team.
Thank you.
Absolutely. And I do have the honor of introducing Dr. Arantes today, and I hope I'm pronouncing that right. And Dr. Marlene Arantes, MD, is the Hub Senior Partner Outreach Specialist. She promotes health literacy and culturally responsive language to enhance the health and well-being of underserved communities, particularly low-income families and Latino populations. She has an extensive prior experience as a program director and health educator with various nonprofit organizations in Washington, D.C. and Maryland. Dr. Orentes earned her medical degree from the Evangelical, sorry about that, University of El Salvador. And everyone, please join me in welcoming Doctor here. And here you go.
Okay, thank you for the introduction. Can I share? Thank you so much and for having me. Can I share my slides, please?
Sure. Let me see if I can pass that over to you. I'm sorry, give me 1 second. I didn't know you had slides.
Yeah, I'm just gonna jump in real quick, Shanae.
Sure.
Marlene, you can just go ahead and share from your end. You don't need permission from
Perfect.
us.
Oh,
Okay,
okay.
great.
Thank you. Thank you so much. Let me see.
Thank you, Taylor.
I'm sorry. Let me see. Let me see. Oh, I can share this. This computer is no.
It's usually a button that says share at the top of your screen next to the leave button. Do you see that?
Yeah, share.
Okay. Yes.
Yes, ma'am.
And okay. Let me see. Oh Lord.
There you go.
Oh Lord. Let me see. I don't find my.
You were sharing your screen.
Mm-hmm. Yeah, I know. Let me see. I don't like this. Uh,
You can hit stop sharing. Yeah, there you
mhm.
go. Okay.
And then share again.
Yes, and you can pick the window that you want to share.
Let me see the window. Oh, here we go. Did you see now?
Yes, we
Yes.
can see.
Oh, okay, great. Um, Thank you so much for having me today. And then this presentation is less than 4 minutes, and let's discuss how the Horowitz Center for Health Literacy help individuals understand and utilize health information that is very important for us and for the community, ensuring everyone has an equal opportunity to maintain their health and receive the care they need is so important. So the hub has established by Maryland law in 2022, and the Horowitz Center was chosen to lead it. The center is dedicated to improving health literacy at all levels, individuals, families, communities, organizations, and society as a whole. And our goal is to improve and increase health literacy in Maryland. Health literacy has two sides. Personal health literacy, that is the degree to which individuals find, understand, and use and decide for self and others. And also, we have organizational health literacy, that is the degree to which organization enables individuals to find, design, understand, use, and decide for self and others. And from a public health view, health literacy and health equity are connected. So health equity, as you know, means that everyone has the opportunity to achieve their optimal health. What is the importance of health literacy in every organization in the complete state? Using health literacy best practices build trust and support health equity. And trust help people seek care and make healthy choices. So here are 3 recommendations included. Using plain language. But what I mean plain language is communication that your audience understand the first times they hear, see, or read it. So there are enables your audience to find what they need, understand what they find, and also use what they find to meet their need, and also communicate in people's preferred language and channel. And that is language access, and also be culturally respectful. And all of those 3 recommendations, we are working on that with our whole hub partner. We will work with, you see there, state and local governments, educators, elected officials, community health worker, nonprofit and community organization, and also health system and hospital. And our hub connect people and organization to make health, safety, insurance, and social services more accessible and easier to understand. And how works, you can support and we can share. So we provide training and educational session, and you can be part of that and support us like a monthly webinar and also annual convenings. And we provide also health literacy for community health worker training online. And also we have good question for good health workshop for community health worker. And we provide also template and model language like Maryland Plain Language checklists, web content review tools, health literacy for media campaign, and also for grants and contract. And we provide workshop and technical assistance. So we would love for you to be part of this work. And please let us know how you would like to join or learn more about. And I will putting in the chat so many links that you can review after all, and also an email where you can support us and attend to the monthly webinar and annual convenience and anything else that you need. We are here to support you. Thank you.
Awesome. Thank you so much. Does anybody have any quick questions before we move to our next agenda item? All right. Hearing none. Dr. Arantes, yes, please feel free to add your information to the chat, which I think I see here. And we will definitely be in touch for sure. So thank you so much.
Yo, thank you.
Of course. All right. So as a reminder, we would like to have at least 2 brief partners in focus mini presentations each month or each meeting. So these presentations would be about 5 minutes each. So if you are interested in sharing about your organization and your work, or if you know of another partner in the community that it would be beneficial for us to hear about what they're doing, please feel free to use the link that's provided in this presentation to sign up. I do believe we have September covered already, but there was some availability for some upcoming months the last time I checked. So thank you all for those who did sign up, and there's still space for some more. So don't forget to do that. All right, moving on, we will now have the pleasure of hearing from Ms. Brittany Vasquez from the Prince George's County Health Department, who is going to share about the county's Extreme Risk Protection Order program. But before we do, I just want to share a little bit more about her. If you're following along on the screen, Ms. Vasquez is a licensed clinical social worker with an advanced certification in forensic social work. She has worked with court-involved youth, incarcerated people, returning citizens, and transition-aged youth as well. She began working at the health department as a lead clinical case manager at the Bridge Center, where she provided case management to returning citizens, veterans, and transition-aged youth. Ms. Vasquez then became the Behavioral Health Division's program manager and oversees the grants and special programs. So in this role, she has implemented the System of Care and Healthy Transitions grants, which were awarded by SAMHSA. And in addition to this, she secured the Byrne State Crisis Intervention Grant from the Governor's Office of Crime Prevention and Policy. If I said that wrong, please forgive me. She currently manages the IRPO Liaison Program, Community Case Management, and a number of Justice Initiative programs. So Ms. Vasquez, thank you for being with us today, for joining us and sharing about this great program, and I will turn it over to you. I have your presentation embedded in the slides, so whenever you're ready for me to advance, just let me know and I can do that for you.
Okay, thank you so much for the introduction and for inviting me to speak about our IRPO Liaison Program. You can move on to the next slide. So a lot of people haven't heard of what an Extreme Risk Protective Order is. So to give you a little bit of background, it's a time-limited court order that mandates that the respondent has to surrender any firearms or ammunition to law enforcement. And while it's in effect, it also prohibits the respondent from purchasing or possessing any firearms or ammunition. This is information that gets put into a nationwide system. So even if they tried to go across state lines to purchase a firearm, they would not be able to. The court may refer the respondent for an emergency evaluation, and petitions are filed in district court. Sometimes they can be filed in circuit court, but they're primarily handled in district court, and they're also sometimes referred to as red flag laws. Next slide. So an IRPO is not the same as a peace or protective order. The ERPO focuses on temporarily removing firearms from an individual who has been identified as being a risk to themselves or others. So it doesn't restrain them from contacting the petitioner, much like a peace order or protective order may do. It solely focuses on removing the person's access to firearms and ammunition. Next slide. So who is the petitioner? This is the person who is going to actually file the ERPO against another person. So the petitioner can be a spouse, a cohabitant, so, you know, a domestic partner, a relative, an individual who shares a child or children with the respondent, an intimate partner, a current or past legal guardian. And in this, it can also apply to like stepchildren, step parents, law enforcement officers, and certain medical professionals who have examined the individual. Maryland is the first state that allowed behavioral health providers to petition the court for an ERPO. So if you're a counselor and you're working with a client and they're saying some concerning things that they might harm themselves or others, and you know that they have access to firearms, as a healthcare professional, you can move forward with filing a petition. Next slide. So who is the respondent? This could be any individual who has or has access to firearms and has acted violently or has made threats to harm themselves or others, has used a firearm in a reckless or negligent way, has violated a peace or protective order, has become threatening when engaged in drug and or alcohol use, and has engaged in other concerning behaviors documented in medical records. Next slide, please. So what is the ERPO Liaison Program? So this year, the Governor's Office of Crime Prevention and Policy awarded Prince George's County Health Department with the Burn State Crisis Intervention Grant, and this allowed us to create an ERPO liaison programs. There were 2 other counties that were awarded this grant as well. So the other 2 sites are Fredericks County and Baltimore. So the program will include the formulation of an ERPO coordinating council, ERPO training, and connection to community-based services for respondents and petitioners. Next slide, please. So who is involved? The Prince George's County Health Department, we're leading the ERPO liaison program, and that our team consists of me and Alex Budens, who is my supervisor, and our ERPO liaison. The Office of the Sheriff is involved because they are actually the ones who serve the ERPOs, and they also remove the firearms and give the firearms back to the respondent when the ERPO petition has expired or been terminated. District Court, this is where the ERPOs are filed, behavioral health providers, residents in the community, and we're continuing to expand our network. Next slide, please. So the ERPO Coordinating Council, this is a council that we want all of our key stakeholders to be part of. So that involves Office of the Sheriff, District Court, behavioral health service providers, but we also want the input of impacted county residents as well, so that we could discuss the ERPO filings, how it's being utilized, when it's being utilized, what situations. Primarily right now, it's being utilized more so in domestic violence situations, but we want to make sure that people are understanding that this is something that this is a tool that can intervene in any firearm violence, regardless of if it's domestic violence or not. So we'll have those discussions, as well as if there's any gaps that the health department having this program can fill in the community. Next slide, please. So the ERPO training, this training can be facilitated virtually and in person. For our county employees, this will also be available on our county training portal in a self-paced version. The trainings will include education on ERPO filing, enforcement of orders, confidentiality protection, distinction between risk levels, available resources through the ERPO liaison program as well. And then we have our ERPO liaison training contact information so that anyone who's interested in having a training for their organization or their team can reach out to us and we could get that scheduled. Next slide, please. Connection to services. So another aspect of this program is actually working with the people who are impacted. So we're going to be partnering with behavioral health providers in the community, so that we can make sure that we are connecting the respondents to the services that will be able to address the stressor that may have caused or triggered the crisis that they were in that led to them needing the ERPO in place. On the petitioner side, we are partnering, we are partnered with My Covenant Place. They provide assistance to petitioners when it comes to filling out the ERPOs, going to court with them, and connecting them with the services that they need. They focus primarily on domestic violence related petitions. So we do have some providers who are able to work with people and fill that gap for the petitioners that are petitioning for a non-domestic violence related situation. So you can petition the court for one if someone, is threatening to harm themselves, or if they're threatening to carry out a mass shooting or a homicide. So it doesn't always have to be domestic violence related. Next slide, please. So that is the overall view of the ERPO liaison program. The actual training goes much deeper into the entire process and what we offer in the liaison program. But if there are any questions, I'm happy to answer them. Or if you want to reach out to me later, that's fine also.
Brittany, hi. It's
Hi.
Larry from Shepherd. I have a
Larry.
question for you.
Yeah.
I know, let me just first say thank you so much. I totally believe in the ERPO concept, but I know when I talk about it with therapists, even where I work, I guess a lot of them are concerned that the ERPO process, bringing the police to someone's home, searching for whatever lethal means they might have, they're worried that it could, escalate the situation or bring, just another dimension of risk to the situation. And I was just wondering if you could walk us through what is the process with the sheriff's department for how, like, they remove the weapon from the person. I mean, is there some I know, to say there might be some diplomatic way or more sensitive way to remove it. If you follow what I'm saying.
Yeah. So from my understanding, the sheriff's office will go to the respondent, wherever they're located in the county. They will serve them with the paperwork, explain to them what this means. And then this is part of a gap in the whole process, is that in that petition, they're already informed of what firearms this person has, specifically the registered ones. If it's something that's not registered, like long guns or firearms that have been obtained illegally, they would have to rely on the petitioner to let them know exactly where those firearms are, or the respondent to be honest and let them know that they have those in the home. So they're only going in to serve the papers, but then also go to the specific areas in, let's just say, the home that these firearms would be located. When it comes to like an actual search, they don't do much of a search unless they have probable cause to think that this person is hiding firearm somewhere, then they would have to go to a judge and get a warrant and come in. But we do understand the concern that petitioners have with potentially escalating the situation. But it's not, when the sheriff's office goes in, it's not like a full on going into the home and really searching through everything. They're going to go to the locations that have been indicated in the actual filing the petition, as well as discuss with the respondent where the firearms are in the house to get them.
Oh, no, that makes sense. And if I could just follow up, I mean, I know where I work, in the division, we work with a lot of kids who have suicidal ideation, and it's really like the parent who has the firearm. And I guess the concern is the therapist, asks the parent, if they could remove the firearm from their house because of the risk to their child in using it in a suicide, but we're never really sure, if the parent has followed through and removed the weapon. And I mean, people have asked, I mean, should that be an ERPA? Would the sheriff's office ensure that the family has removed all the firearms? And again, I'm not really sure if that's the best approach or not. I mean, it makes some sense to me, but I just also wonder if you'd comment on that.
Yeah, so in situations where the parent has a firearm and there's a concern about the child using it to harm themselves or someone else, an ERPO can be placed in effect, especially if you know that the child can have access to that firearm, like it's not secured properly, or maybe the child knows how to access the secured firearm. That's when you can file an ERPO as it being used in a negligent manner. So if it's not being secured, or the child knows how to get it from the secured location, you can file it. What's really important with these petitions is just being very specific and giving examples and why having this firearm accessible to this person is a danger.
Great. Thank you so much.
You're welcome.
Are there any other questions?
I think I
have one.
Oh, yeah. Go ahead.
Yeah, so I guess when I think about going to file a petition, these things take time, right? It's not like you go in, you get your paper, and you go home. Or is that the case? Like, what is the typical timeline from ERPO petition filing to actual enforcement?
Yeah, so from ERPO petitioning filing to enforcement is pretty rapid.
Okay.
You can file an ERPO at any time of the day, anytime, any day. If it's during business hours, you could do it with the clerk. If it's after hours, you could do it with the district court commissioner. And they will determine if an interim, based on the information in the actual petition, if an interim ERPO needs to be put in place immediately, then they will do that up until the temporary hearing with the judge, which has to be scheduled within like 7 days. And then from there, the judge will determine if this needs to be a longer term thing, if there needs to be a final hearing scheduled for a not permanent, but for a longer term ERPO to be put in place. So based off of what information is put in the petition, the commissioner could issue an interim ERPO, and then that's when the sheriff's office will go out, serve the papers to the respondent so that they could be present to the temporary hearing if they choose to. They don't have to be. And then make sure that those firearms are removed.
Okay, great. Thank you. And I guess another question I was thinking, you had mentioned some of the partners that you all are working with as a part of this program. And I think for for the example that you gave about a domestic violence case, if a partner is petitioning for ERPO, but they need protection while the process is happening, or maybe even after, what supports are available to them? Do you offer temporary housing? What kind of support is available during this process?
Yeah. Yeah. So My Covenant Place has a lot of resources in the community to make sure that if this is a domestic violence situation and they're filing this ERPO, that if they do need to be removed from the home for safety reasons, that they do have partnerships with other agencies that are able to offer that support to petitioners. So they will be working with petitioners that are filing because of domestic violence to make sure that they are connected to the resources that they need, especially if they need to leave that home.
Great, thank you.
Thank you.
Any other questions from our friends here? All right. Well, hearing none, I just want to thank you again, Ms. Vasquez, for presenting to us today about your ERPO program, the ERPO Liaison Program, and for providing some contact information that will be shared on the slide. I will make sure that everybody gets a copy of the slide and the meeting presentation as well. But thank you again for your time. And if anyone has any follow-up questions, please feel free to contact Ms. Vasquez directly.
Thank you so much.
Sure. Thank you. All right. So moving on, we will now have very quick update from Miss Margaret, who will share briefly about some updates regarding the Dyer Care Center.
Thank you, Shanae. I just wanted to let everyone know today that that the behavioral health services that were delivered at Dyer Care Center was halted as of July 31st of this year. Recovery Innovations, who operated these services, decided to terminate its contract with Totally Lincoln Care of Maryland. And Prince George's County is actively working to identify a new vendor to ensure continued crisis stabilization center or services for the residents of all ages. And then during this transition, county residents are still have access to behavioral health crisis services 24/7. By calling, texting, or chatting 988, and they can also continue to request mobile crisis response teams, which are still available. And we are in collaboration with the county executive's office and are still working through logistics and the best way to move forward. And as more information becomes available, we'll make sure that we share it with this group.
Great. Thank you so much.
You're welcome.
Okay. So now I'm going to go ahead and share some community announcements. We have quite a few, so bear with me. But the first one I have, August is National Immunization Awareness Month. It is wild to think that we are already nearing the end of August. I feel like it just started. But National Immunization Awareness Month, it's just organizations all around are utilizing this month to observe, to highlight the importance of vaccinations for people of all ages. I think as a coalition, we can help raise awareness about the importance of vaccination and encourage our residents to attend the Prince George's County Health Department Back to School vaccine clinics. They're actually currently being held. They started August 6th and will continue through September 27th. So there are a variety of clinics at multiple locations. Some are offering weekend availability, some have weekday availability. The flyer is on the slide, but I will make sure to send that out as well once I send all of the presentations and slides to you all after the meeting. Prince George's County Extension will be hosting an open house on Thursday, September 4th from 5:30 to 7 p.m. for residents to learn about free community programs. It looks like they're giving away some good some goodies, some ice cream, some free plants. So if you are available or know someone who is interested, the flyer and registration link are on the slide. And again, I will be sure to share that out. There's so much going on in our county. Prince George's County will also be having their 2025 Family Caregivers Conference on Thursday, September 25th from 10 a.m. to 2 p.m. Registration link is on the slide as well as the flyer. This event will take place at Martin's Crosswinds in Greenbelt. And it says it is open for those who care for older adults or individuals with Alzheimer's disease or related dementia. So one thing to note is that the registration is required due to limited seating. So if you are interested or know someone who might be interested, please feel free to share this out. Okay, 988 training. Our partners with Everymind and Adventist Healthcare are offering a webinar that is designed to essentially help healthcare providers understand a little bit more about the 988 Suicide and Crisis Lifeline and its role in mental health and crisis response. So they've been sharing about this webinar essentially to teach us about key services that 988 offers, to share about the 24/7 crisis counseling, connection to local resources, as well as coordination with emergency services. Their first session, I think, was held yesterday, but I do believe there is another one tomorrow in the evening. So the registration link is embedded in the slide. And again, I will make sure to send this out to everyone. International Overdose Awareness Day is Saturday, August 31st. Some of our partners will be at the Laurel Multi-Service Center for a training session on how to use naloxone to potentially save someone from an opioid overdose. This is an in-person event, and they're going to share all about naloxone, all the skills that are needed to act quickly in the event of an emergency. Those who do attend will receive naloxone after they complete the workshop. So again, please share this event and register to attend so you don't miss the opportunity to make a difference in your community. I think this is my last announcement. The second annual Health and Wellness Expo will take place on September 20th at 11 a.m., I think to 2 p.m. at Trinidad Baptist Church. There will be free wellness checkups, free dental screenings, fitness demonstrations, and so much more. So this event is free. It's open to the public. So again, please just share this flyer out with your partners, with your colleagues, friends, family, community residents. The registration link is listed. And I think this would be a fun event for everyone to attend and support if we can. Are there any other announcements from our partners that anyone would like to share? That's all right too. Taylor, do you have anything that needs to be touched on?
I was just going to quickly ask if anyone from the health department team knows about 988 Day taking place on September 8th. Is there anything we can share around that announcement?
I'm sorry, my audio kicked out. Do you mind repeating that for me?
Absolutely. I was just asking the health department team if anyone was aware of the 988 Day that the county executive is planning on September 8th.
Hi, Taylor. This is Denise. My understanding is 988 Day has been designated in the county on September 8th. CCSI will be providing some suicide training, and the vast majority of county leadership will be participating in that training. My understanding is from 8 to 1 or 8 to 12, and that the training will be occurring in different sessions. I think they'll be doing like groups or cohorts of like 30 or something like that to get folks. I think there are 120 slots, and to get folks through the training for that suicide prevention training. And there's a flyer. I will share it so that it can go out with the slides and everything else.
Thank you.
Thanks, Denise. Otherwise, that's all I had. Any other community announcements? Anything coming up that anyone is tracking?
All right. Okay. Well, if nothing else, I do want to remind you that our full coalition quarterly meeting is coming up. It is a virtual meeting. It will be held on Tuesday, September 9th from 6 to 7:30. The link to register is provided on the slide, but I also put the QR code. So this is your fantastic opportunity to go ahead and scan that and get yourself registered for that meeting. I will leave that up for a few minutes for you all. And then following that, we will have our next monthly work group meeting on Wednesday, September 17th, same time, same place, 3:00 p.m. So I'll leave this QR code up for a second, for a minute for anybody who is scanning and needs to register. I will also make sure that this goes out in our follow-up correspondence.
And Shanae, the link is in the chat. So anyone who wants to go ahead and register now, it is a quick registration link. But many folks have attended our quarterly Prince George's Health Action Coalition meetings in the past. It's a good time for us to come together across all 4 of our work groups. We're going to be providing some really important county level updates at this meeting. You'll get to hear a little bit more about the community health assessment that is now live and get to ask the health department some questions. So please come out to that event if you are able to do so. Again, it's going to be virtual, taking place via Teams. We'd love to see you there and would love to connect you all with some folks.
All right. Well, thank you all so much for being here. I'm giving you back quite a bit of time today. But if you have any questions or need to touch base with me or follow up, you're most welcome to reach out to me via email and I'd be happy to hear from you. If any of you want to just set some time aside to meet separately so I can learn more about you and your organization, I am most willing to do so as well, especially as I continue to transition here and meet new people every day. I'm meeting new people. So I'd love the opportunity to set some time aside with each of you to learn more about who you are, what you do in your organization, and how we can best serve each other in this capacity. Thank you so much for your time, everyone. Have a great afternoon.
Thank you, Shanae.
Thank you.
Take care.
Too. Thank you.